The United States faces a formidable adversary: substance abuse. This issue is not confined to any one demographic or region. It permeates every layer of society, affecting people from all walks of life. It casts a long shadow, touching countless lives and communities. From bustling cities to quiet rural towns, no place is immune to its reach. From prescription opioids to illicit drugs, the grip of addiction tightens its hold, leaving devastation in its wake. Families are torn apart and communities struggle to cope with the fallout. Why is this problem so pervasive in America? What drives so many individuals to seek solace in substances that ultimately destroy their lives? What factors contribute to its alarming rise? Is it the pressures of modern life, economic instability, or perhaps a lack of adequate mental health support? This essay delves into the heart of this crisis, examining the historical, social, and economic forces at play. We will look at how past policies and societal changes have shaped the current landscape. We will hear from individuals battling addiction, their voices filled with both despair and hope. Their stories will shed light on the human side of this epidemic, revealing the struggles and triumphs of those affected. Experts will provide insights into the complexities of this issue, offering potential solutions. They will discuss the latest research, treatment options, and preventative measures that could help curb this crisis. Together, we will explore the path towards a healthier, more resilient nation. By understanding the root causes and working collectively, we can hope to build a future where substance abuse no longer casts its dark shadow. To understand the present, we must look back. The roots of today's crisis are deeply embedded in our history, stretching back over a century. The history of substance abuse in America is a long and winding road, marked by shifting attitudes, policies, and consequences. Early on, substances like opium were readily available and even used in medicinal products. Over time, as the dangers became more apparent, society's views began to change. From the early days of readily available opium to the emergence of cocaine and heroin in the 20th century, the nation has grappled with the allure and dangers of addictive substances. The early 1900s saw a rise in the recreational use of these drugs, leading to the first wave of drug-related problems and the initial attempts at regulation. The Prohibition era, with its unintended consequences of organized crime and bootlegging, offers a stark lesson in the complexities of substance control. While alcohol was the primary target, the era highlighted the challenges of enforcing bans and the unintended rise of illegal markets. Similarly, the war on drugs, launched in the 1970s, has had a profound impact, shaping criminal justice policies and disproportionately affecting marginalized communities. This era saw a significant increase in incarceration rates, particularly among minority populations, and raised questions about the effectiveness and fairness of such policies. Understanding these historical patterns is crucial in informing our approach to the current crisis. By examining the successes and failures of past policies, we can better navigate the complexities of today's substance abuse issues and work towards more effective and equitable solutions. The lessons of history remind us that the path forward requires a nuanced and compassionate approach. Beyond historical context, societal factors play a significant role in fueling substance abuse. The pressures of modern life, characterized by relentless competition, social isolation, and a constant barrage of information, can take a toll on mental and emotional well-being. For some, drugs and alcohol offer a temporary escape from these overwhelming feelings. Furthermore, social inequalities such as poverty, lack of access to education and healthcare, and systemic racism create environments of vulnerability. Individuals facing these challenges may turn to substances as a coping mechanism, seeking solace in a world that often feels indifferent to their struggles. Addressing these root causes is essential in breaking the cycle of addiction. Economic factors are inextricably linked to substance abuse. The loss of manufacturing jobs, stagnant wages, and rising income inequality have left many Americans feeling hopeless and disillusioned. In communities ravaged by economic decline, drugs and alcohol can provide a sense of purpose, belonging, and escape from the harsh realities of daily life. The opioid epidemic in particular has hit hardest in areas grappling with economic hardship. The overprescription of painkillers, driven in part by pharmaceutical companies seeking profit, has had devastating consequences, leading to widespread addiction and overdose deaths. Addressing the economic anxieties of our time is paramount in tackling this crisis head-on. Section 5. Voices from the Abyss, Personal Stories of Struggle and Resilience. In this section, we delve deep into the heart-wrenching yet inspiring stories of individuals who have faced the darkest moments of their lives and emerged stronger. Behind the statistics and data lie real people, each with their own unique story of struggle and resilience. These are not just numbers, they are mothers, fathers, sons, and daughters. Each story is a testament to the human spirit's capacity to endure and overcome. Hearing these personal accounts humanizes the issue of substance abuse, reminding us of the profound impact it has on individuals, families, and communities. It brings to light the emotional and psychological toll that addiction takes, not just on the person suffering but on everyone around them. One recovering addict shared, "Addiction doesn't discriminate. It doesn't care about your age, race, or socioeconomic background. It can happen to anyone." This powerful statement underscores the universal nature of addiction, breaking down the barriers of stigma and prejudice. It doesn't care about your age, race, or socioeconomic background. It can happen to anyone. This reality is a sobering reminder that addiction is a pervasive issue that can touch any life, regardless of external circumstances. It can happen to anyone. The randomness of addiction's grip makes it all the more important to foster a society that is compassionate and supportive. Another individual spoke of the long and arduous journey to recovery, emphasizing the importance of support systems and access to treatment. Recovery is not a straight path, they said. It's filled with ups and downs, but having a strong support system can make all the difference. These stories serve as powerful reminders that behind every case of substance abuse is a human being deserving of compassion and understanding. They highlight the need for empathy, support, and comprehensive treatment options. By sharing these personal narratives, we hope to inspire change and foster a more inclusive and supportive community for all those affected by addiction. Section 6. Expert Perspectives, Unpacking the Complexities of Substance Abuse. To fully grasp the multifaceted nature of substance abuse, we turn to experts in the field. Medical professionals, researchers, and social workers provide valuable insights into the biological, psychological, and social factors that contribute to addiction. Dr. Sarah Johnson, a leading addiction specialist, explains, "Addiction is a complex brain disease characterized by compulsive drug seeking and use, despite harmful consequences. It's not a moral failing or a lack of willpower. Understanding the science behind addiction is crucial in developing effective prevention and treatment strategies." Section 7. Breaking the Cycle, a multifaceted approach to prevention. Preventing substance abuse requires a multifaceted approach that addresses the issue from various angles. Early intervention programs, particularly in schools, can educate young people about the risks of drugs and alcohol, equipping them with the knowledge and skills to make healthy choices. Creating supportive environments within families, schools, and communities is equally important. Open communication, positive role models, and access to extracurricular activities can provide individuals with a sense of purpose and belonging, reducing their vulnerability to substance abuse. Section 8. Treatment and Recovery, a beacon of hope for those in need. For those already struggling with addiction, access to effective treatment and recovery services is paramount. This includes a range of options, such as detoxification, inpatient and outpatient rehabilitation programs, counseling, and support groups. Medication-assisted treatment, or MAT, has also emerged as a valuable tool, particularly for opioid addiction. Medications like methadone and buprenorphine can help reduce cravings and withdrawal symptoms, increasing the chances of successful recovery. It's important to remember that addiction is a treatable disease, and recovery is possible with the right support. Section 9. The Role of Policy Towards a More Supportive Environment. Public policy plays a crucial role in shaping the environment in which substance abuse thrives or diminishes. This includes addressing the social determinants of health, such as poverty, lack of access to healthcare, and education inequality. Investing in prevention programs, expanding access to affordable treatment, and implementing harm reduction strategies, such as needle exchange programs and supervised consumption sites, can significantly impact the trajectory of this crisis. By creating a more supportive and compassionate society, we can mitigate the factors that contribute to substance abuse. Section 10. Community Action, Empowering Individuals and Neighborhoods. Addressing substance abuse requires a collective effort. Communities across the nation are mobilizing, taking action to support those affected by this crisis and prevent further harm. Grassroots organizations, faith-based institutions, and concerned citizens are coming together to provide resources, raise awareness, and advocate for change. From organizing community forums to hosting naloxone training sessions, these efforts are making a tangible difference. By empowering individuals, strengthening neighborhoods, and fostering a sense of shared responsibility, we can create a ripple effect of positive change. Section 11. Shifting the narrative, challenging stigma and fostering compassion. Stigma surrounding substance abuse remains a significant barrier to seeking help and achieving lasting recovery. Too often, addiction is viewed as a moral failing rather than a health condition, leading to shame, isolation, and discrimination. It's crucial to challenge these harmful stereotypes and foster a culture of compassion and understanding. By sharing stories of recovery, promoting accurate information, and advocating for policies that support those affected by addiction, we can help shift the narrative and create a more supportive and inclusive society. Section 12. A call to action. Join the movement for change. The fight against substance abuse requires a collective effort. Each one of us has a role to play in creating a healthier, more resilient nation. Educate yourself about the issue, challenge stigma, and support organizations working on the front lines. Reach out to your elected officials, urging them to prioritize policies that address the root causes of addiction and expand access to treatment and recovery services. Together, we can make a difference. Section 13. Stay informed, stay inspired, subscribe and follow. This is just the beginning of the conversation. To stay informed about the latest developments in the fight against substance abuse, subscribe to our newsletter and follow us on social media. Together, let's continue to learn, share, and inspire change.